Hello class, welcome to Emergency Care and Transportation of the Sick and Injured. This is Chapter 5, Medical Terminology. After you complete this chapter and the related coursework, you will be able to use foundational and anatomical medical terms and abbreviations in written and oral communication with colleagues and healthcare professionals. You will understand the purpose of medical terminology, be able to identify its components, and be able to define an unknown medical term based on the dissection and understanding of its components. You will also be able to identify error-prone medical abbreviations and acronyms. Common direction, movement, and position terms are also presented in this chapter. As an EMT, you must have a strong working knowledge of medical terminology. For effective communication and documentation, you must understand key terms, acronyms, symbols, and abbreviations. You can determine the meaning of an unknown word by understanding how terms are formed and learning the definitions for parts of a medical term. Understanding medical jargon will help you communicate effectively with other members of EMS, healthcare, and public safety teams. Now let's discuss the anatomy of a medical term. Medical terms are made up of distinct parts that perform specific functions. Changing or deleting any of those parts can significantly change the function or meaning of a word. Components that comprise medical terms include the word root, which is the foundation of the word, prefix, which occurs before the word root, the suffix, what occurs after the word root, and the combining of vowels that join one or more word roots to other components of a term. How the parts of a term are combined determines its meaning. Accurate spelling is essential in medical terminology. The suffix phasia means speaking, whereas phagia means eating or swallowing. The prefix dis means difficult or painful. Dysphagia means difficulty speaking, while dysphagia means difficulty eating or swallowing. Also, for example, the terms ilium and ilium are pronounced exactly the same, but refer to different anatomical parts. Knowing anatomy and the context of how these words are used can help you correctly determine and spell the term in a given situation. So how the parts of a term are combined determines its meaning. So it is also important to have a knowledge of anatomy and the context of how words are used. The main part or stem of a word is called a word root or root word. It conveys the essential meaning of the word and frequently indicates a body part. Most terms have at least one word root and some have more than one root. Adding a prefix or suffix to a word root creates a term. Changing the prefix or suffix will change the meaning of the term. Cardiopulmonary breaks down as follows. Cardio is a word root meaning heart. Pulmon is a word root meaning lungs. By performing CPR, you introduce air into the lungs and circulate blood by compressing the heart. Some word roots may be used as prefixes or suffixes for other terms. A prefix is the part of a term that appears at the beginning of a word. Prefixes usually describe location and/or intensity. Prefixes are found in general language, i.e., autopilot, submarine, tricycle, as well as in medical and scientific terminology. Not all medical terms have prefixes. A prefix gives the word root its specific meaning. For the word root pnea, one can add the prefix a, which means without, brady, which means with slow, or tachy, which means rapid, to create three very different terms. By learning the commonly used medical prefixes, you can figure out the meaning of terms that may not be immediately familiar to you. Now let's discuss suffixes. Suffixes are placed at the end of words. Suffixes usually indicate a procedure, condition, disease, or part of speech. A commonly used suffix is itis, which means inflammation. When paired with the root arthro, meaning joint, the resulting word is arthritis, which means inflammation of the joints. Combining vowels is important also. A combining vowel is the part of a term that connects a word root to a suffix or another word root. In most cases, it is an O. However, it may also be an I or an E. One example is gastroenterology. Gastro plus entero plus logy, and you end up with gastroenterology, which translates into stomach plus intestines plus the study of. Thus, gastroenterology. The combining vowel helps ease the pronunciation of the term. A combining form is a combining vowel shown with the word root. Some common combining forms are cardio, which is heart, gastro, which is stomach, hepato, which is liver, arthro, which is joint, osteo, which is bone, and pulmono, which means lungs. Some word building rules. When building or taking apart a medical term, it is helpful to understand some basic rules. The following summarizes the rules covered thus far. The prefix is always at the beginning of a term. However, not all terms have a prefix. The suffix is always at the end of the term. Use a combining vowel when a suffix begins with a consonant to make pronunciation easier, and a term has more than one word root. A combining vowel must be placed between the two word roots, even if the second root begins with a vowel. Now we'll discuss plural endings. To change a term from singular to plural form, there are certain rules that apply. Sometimes you can simply add an S, lung becomes lungs, but some rules are more complicated. Some rules you may encounter when converting from singular to plural terms are singular words that end in A change to AE when plural. Example, vertebra becomes vertebrae. Singular words that end in IS change to ES when plural. Example, diagnosis becomes diagnoses. Singular words that end in EX or IX change to ICES. Example, apex becomes apices. Singular words that end in ON or UM change to A. Example, ganglion becomes ganglia, ovum becomes ova. And singular words that end in US change to I. Example, bronchus becomes bronchi. Prefixes can be used to indicate numbers, colors, and positions and directions. Let's discuss the numbers aspect. Several prefixes are used to indicate if a term involves a number, such as half, one or two or more parts, or sides. Examples are una, dipla, null, primi, multi, and bi. In regards to color, there are several root words used to describe color. Examples, cyano, leucio, erythro, cero, and melano. In regard to positions and directions, prefixes can also be used to describe a position, direction, or location. Examples: ab, ad, de, circum, para, trans, epi, and supra. Let's talk about common direction, movement, and position terms. As far as directional terms, you need to know the correct directional terms to discuss where an injury is located and how the pain radiates in the body. Some directional terms include right and left, superior and inferior, lateral and medial, proximal and distal, superficial and deep. They also include ventral and dorsal, palmar and plantar, and apex. The terms right and left refer to the patient's right and left sides, not to your right and left sides. And in regards to superior and inferior, the superior part of any body part is the portion nearer to the head from a specific reference point. The part nearer to the feet is the inferior portion. These terms are also used to describe the relationship of one structure to another. For example, the knee is superior to the foot and inferior to the pelvis. With lateral and medial, these are parts of the body that lie farther from the midline, and if they lie farther from the midline, they're called lateral or outer structures. In general terms, lateral means side. The parts that lie closer to the midline are called medial or inner structures. An example, a patient has a 5 centimeter laceration on the medial aspect of the thigh, meaning towards the inside. The terms proximal and distal are used to describe the relationship of any two structures on an extremity. Proximal describes the structures that are closer to the trunk. Distal describes structures that are farther from the trunk or nearer to the free end of the extremity. For example, the elbow is distal to the shoulder and proximal to the wrist and hand. With superficial and deep, superficial means closer to or on the skin, while deep means farther inside the body or tissue and away from the skin. Example, a superficial burn involves only the top layer of skin, similar to sunburn, whereas a deep laceration involves a cut deeper into the tissue, such as with a knife. Ventral refers to the belly side of the body or the anterior surface of the body, while dorsal refers to the spinal side of the body or the posterior surface of the body. Think of the dorsal fin of a dolphin, which is on its back. The more commonly terms used are anterior, which is the front surface of the body, and posterior, which is the back surface of the body. The front region of the hand is referred to as the palm or palmar surface. The bottom of the foot is referred to as the plantar surface. The apex, or plural apices, is the tip of a structure. For example, the apex of the heart is the bottom or the inferior portion of the ventricles in the left side of the chest. Let's discuss movement terms. The following terms relate to movement. Flexion is the bending of a joint. Extension is the straightening of a joint. Adduction is the motion toward the midline, and abduction is motion away from the midline. Some other directional terms that are important is that a body part appears on both sides of a midline, and that is bilateral. For example, eyes are bilateral, ears, hands, and feet are all bilateral, and these are body parts again that appear on both sides of the midline. Structures inside the body also appear on both sides of the midline. For example, lungs and kidneys. Something that appears only on one side of the body is said to occur unilaterally. Example, unilateral chest expansion means that only one lung is expanding with inhalation, such as with a pneumothorax. As an EMT, you should be able to describe the exact location of areas of the abdomen. The abdominal cavity is divided into 4 equal quadrants. You have the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Again, right and left refer to the patient's right and left, not yours. It is important to learn these terms and concepts so you can describe the location of any injury or assessment findings. Use the terms properly so that any other medical personnel who care for the patient will know immediately where to look and what to expect. There are many terms used to describe the position of the patient on your arrival or during transport to the emergency department. You have prone or supine or Fowler position. Prone means lying face down. Supine means lying face up. Fowler position is semi-reclining with the head elevated. The Fowler position is a semi-reclining position with the head elevated to help the patient breathe easier and to control the airway. A patient who's sitting upright is said to be in the Fowler position. Again, the semi-Fowler position is the patient sitting back of a stretcher at a 45-degree angle. The high Fowler position is a patient sitting at a 90-degree angle. You can use the meaning of parts of words to decipher the meaning of a term. When trying to define a term, begin with the suffix and work backward. If the term also contains a prefix, define the suffix, then the prefix, and then the word root. Here are some examples. Neuropathy. Pathy is a suffix meaning disease. O is the combining form. Nepher is a word root meaning kidney. Again, nepher is a word root meaning kidney. So neuropathy means disease of the kidney. Dysuria. Ia is a suffix meaning condition of. Dys is a prefix meaning difficult, painful, or abnormal. Is a word root meaning urine. So dysuria means painful urination or pain when urinating or difficulty urinating. Hyperemesis. Hyper is a prefix meaning excessive. Emesis is a word root meaning vomiting. So hyperemesis or hyperemesis is excessive vomiting. And I pronounced it both ways because you do hear it pronounced both ways. So again, hyperemesis is excessive vomiting. Analgesic. Ik is a suffix meaning pertaining to. An is a prefix meaning without or absence of. Algis is a word root meaning pain. So analgesic means pertaining to no pain. Medical abbreviations, acronyms, and symbols are a type of shorthand used for communication. These were developed because one could communicate faster using this method. It is important, however, not to trade speed for accuracy. Use only commonly understood acronyms and abbreviations to minimize misinterpretations and errors. The Joint Commission and Institute for Safe Medicine Practices are considered two authorities on abbreviations, and they provide do not use lists for acronyms and abbreviations. When you use an abbreviation, you pronounce each letter of the abbreviation separately and distinctly. For the acronym EMT, you say EMT. When you use an acronym, you are shortening several words. usually using the first letter of each word to make the acronym. Acronyms can be pronounced as their own word. For example, sample, history, is pronounced like the word sample. By reading the letters one by one, for example, EMS is pronounced EMS, or by a combination of the two. For example, DCAP BTLS is pronounced DCAP BTLS. Misunderstanding and errors occur if someone involved in patient care does not understand the meaning of abbreviations or acronyms. For this reason, again, some agencies limit the use of abbreviations. Abbreviations take the place of words to shorten notes or documentation. Remember to use only standard accepted abbreviations to avoid confusion and errors. Be familiar with the accepted use of abbreviations in your local jurisdiction or service area. Like abbreviations, symbols are sometimes used as a shortcut in communication and documentation. As with abbreviations, it is important to use only symbols that are widely understood and accepted. The tables in this chapter in your text provide a thorough reference list of common word roots, combining forms, prefixes, suffixes, and abbreviations. I highly recommend that you take the time to review all of that carefully. Now let's go over some review questions that I covered in this lecture to help cement some understanding. The first review question is, which of the following components of a medical term conveys its essential meaning? Prefix, suffix, word root, or combining of vowels? The answer is C. The word root itself conveys the essential meaning of a medical term. The prefix usually describes location or intensity. The suffix will indicate a procedure, condition, disease, or part of speech. And the combining vowels are used to connect a word to the suffix or word root. Now, since we covered the prefix, suffix, etc. in the answer that we just went over, the correct answer for this question, I'm not going to review them again here. But you might want to just review the definition for prefix, suffix, and then word root and combining vowels. Question 2. Prefixes can indicate color, conditions, body parts, or procedures. The correct answer is A. Prefixes are used to indicate colors, numbers, position, or directions. Suffixes, again, as we mentioned a moment ago, will indicate a procedure, condition, disease, or part of speech, while word roots will indicate a specific body part. And just to review again, prefixes can indicate color, which is the correct answer here, while conditions are indicated by the suffix, body parts are indicated by the word root, and procedures are indicated by the suffix, which is why these were not the correct answers. The plural form of the word bronchus is bronchi, bronchus, bronchices, or bronchi. The answer is D. When a word ends in US, the plural form will end in I. For words that end in A, the plural form will end in AE. When words end in IS, the plural form will end in ES. Words that end in EX or IX will have a plural form that end in ICES. Again, you might want to refer to the master table in your chapter of your text, Chapter 5, so that you can have a solid grip on how these transitions work. Just to review again, the plural form of the word bronchus is bronchi, which is incorrect because words that end in plural form will end in AE. Bronchus, when words end in IS, the plural form will end in ES. Bronchices, this one is incorrect because words that end in EX or IX will have a plural form that ends in ICES. In this case, bronchi is the correct answer. Number 4, the statement, the lungs are superior to the bladder, indicates that the lungs are closer to the feet, surface of the skin, head, or trunk. If you think of the head being superior and the feet being inferior, I know you can figure the answer to this one out. The answer is C. The term superior is used to indicate a structure closer to the head than another structure, while inferior is the term used to describe a structure that is closer to the feet. Superficial is used to describe a structure that is closer to the skin than another, while proximal is used to describe a structure that is closer to the trunk in comparison to another. So to review number 4, the statement the lungs are superior to the bladder indicates that the lungs are closer to the feet, which is incorrect here because the term inferior is used to describe one structure being closer to the feet than another. Obviously, the lungs are not closer to the feet than the bladder. B, the surface of the skin. That is not correct because the term superficial is used to indicate that one structure is closer to the skin than another. Number C is head. Again, that's the correct answer because the lungs are indeed closer to the head than the feet. So the lungs are superior to the bladder. D, trunk, is incorrect because the term proximal is used to indicate that one structure is closer to the trunk than another. In this case, we're talking about specific organs, not the trunk in general. Number 5, movement of the arm towards the midline is referred to as flexion, extension, adduction, or abduction. The answer is C. The term adduction is used to describe movement of a structure towards the midline of the body. Flexion refers to the bending of a joint, extension refers to the straightening of a joint, and abduction is used to describe movement of a structure away from the midline of the body. Now here in the answer that we just reviewed, the correct answer, we've covered the correct answer and also described the incorrect answers and their meanings, such as flexion, extension, adduction, which is obviously the correct answer here because that is movement of the arm toward the midline, and also we just described abduction, which is motion away from the midline. Question 6. A body part that lies closer to the midline when compared to another is considered to be medial, distal, lateral, or proximal. The correct answer is A. The term medial is used to identify a body part that is closer to the midline when compared to the other. I always think of medial as closer to the middle or midline. Distal is used to refer to a body part that is farther away from the trunk in comparison to another. Lateral refers to describe a structure that lies away from the midline or towards the side of the body, and proximal is used to describe a body part that is closer to the trunk when compared to the other. Again, here we referred to the correct answer, which is A, medial, but we also described distal and lateral and proximal. Again, make sure you review these terms so that you are completely knowledgeable and comfortable with them. Question 7. This is used to identify a body part that is on the belly side or anterior surface of the body. deep, superficial, dorsal, or ventral? The answer is, of course, D, ventral. This is used to identify a body part located on the belly side or anterior surface of the body. Just think of the belly button being ventral. It's on the ventral side. Deep is used to describe a structure further away from the skin surface. Superficial refers to a structure close to the skin surface, and dorsal describes a structure on the back or posterior side of the body, such as the example we gave earlier, where you can remember dorsal by the fact that most mammals, marine mammals, have dorsal fins. Okay, we reviewed all of the correct and incorrect answers just now. So review each of these terms again on your own: deep, superficial, dorsal, and ventral, so that you make sure that you're completely comfortable with each of them. Question 8. You place a patient in the semi-Fowler's position for transport. This means the patient is A, lying on his or her back, B, lying on his or her stomach, C, sitting at a 45-degree angle, or D, sitting at a 90-degree angle. And we just went over this, but it's pretty easy to remember. I bet you can get this one right without much trouble. The answer is C. A patient that is sitting at a 45-degree angle is said to be in a semi-Fowler's position. A patient is supine when they're on their back. When a patient is lying on their stomach, they're in a prone position. If you have a patient sitting straight up at a 90-degree angle, then you have them in a high Fowler's position. So here in number 8, we've again covered all of the answers, correct and incorrect, all of the correct terms, or I'm sorry, the definition for each of these terms: supine, prone, semi-Fowler's, and high Fowler's. Question 9. A laceration located on the plantar surface is on the sole of the foot, the palm of the hand, back of the body, or the front of the body. You should be able to remember this one pretty easily. And the answer is A. Plantar refers to the soles of the feet, while palmar refers to the palms of the hands. Dorsal or posterior is used when referring to the back of the body, and ventral or anterior is used when referring to the front of the body. And here again is the question. A laceration located on the plantar surface is on the A, sole of the foot. That's the correct answer. B, palm of the hand, is incorrect. Palmar is the palm of the hand. C, back of the body, is dorsal or posterior, so that would be incorrect here. And ventral or anterior is the front of the body, and that would be incorrect here, because the laceration is on the plantar surface, which means it's on the sole of the foot. And number 10, when using abbreviations, acronyms, or symbols, an EMT should A, be familiar with those used in your agency, B, use only those that are medically accepted, C, use them to shorten documentation, or D, all of the above. The correct answer is D. Before using abbreviations, acronyms, or symbols in your documentation, it is important to know which ones are accepted or standard for use by your agency. You should only use those that are medically accepted, so anyone who's reading your report can understand what you are saying. To minimize the length of your documentation, you can use abbreviations, acronyms, and or symbols. So let's just review number 10 one more time. When using abbreviations, acronyms, or symbols, an EMT should A, be familiar with those used in your agency, That is the correct answer. An EMT should be familiar with abbreviations, acronyms, and symbols used by his or her agency. B, use only those that are medically accepted. This is also a correct answer because an EMT should use abbreviations, acronyms, or symbols that are medically accepted across the medical profession. C, use them to shorten documentation. This is also a correct answer because EMTs can use abbreviations, acronyms, or abbreviations to shorten documentation. Or D, all of the above, which is the most correct answer because all of A, B, and C apply. Class, thank you for your time and attention on Chapter 5. This is a difficult subject, so I suggest again that you refer to the master table in your text for Chapter 5 and make sure you have a clear understanding of how medical terms are broken down and put together, and so that you can interpret terms that you may run across that you're not immediately familiar with, but by context can figure out the meaning of. And then also make sure that you are familiar with standard abbreviations and acronyms and symbols. Again, thanks for your attention, and we'll see you in Chapter 6.